Periodontal disease causes approximately 75% of all adult tooth loss. Today, most dental researchers agree that periodontal disease is the result of a bacterial infection. Dental researchers also agree that most of the damage to the bone and soft tissue is due to the inflammatory response of the body. This inflammatory response occurs as the body attempts to neutralize the bacterial toxins, which are excreted by the periodontal pathogens, which are living subgingivally in periodontal pockets. Our professional strength formulae are effective three ways. Working synergistically, our truly natural antimicrobials, connective tissue rebuilders, and tissue conditioners effectively establish an environment in which inflamed, swollen, or bleeding tissue will usually respond in just a few weeks. The following is a demonstration of the powerful antimicrobial properties that both the tonic and the irrigant exhibit against virulent periodontal pathogens. We have prepared and recorded these microbiological specimens in order for you to see the effectiveness of our truly natural botanical antimicrobial formulations. This subgingival sample was taken from a class 2 periodontal patient. The motile bacteria are predominantly spirochetes, along with some small motile rods. There are also a few large non-motile rods present. Large numbers of white blood cells are evident as the body responds to the bacterial infection. Note the aggressive nature of spirochetes attacking the body's immune system. We have here a group of spirochetes attacking what may be the remnants of a dead white blood cell. Note the continuous movement of these virulent microorganisms. In addition to spirochetes, this subgingival sample contains numerous large and small spinning rods, gliding rods, and large non-motile rods. Note the vigorous activity as the hydrostatic pressure begins to change. As the irrigant begins to run through the sample, the spirochetes and rods are virtually killed on contact. It is quite evident that all microbial activity has stopped. Any apparent continued movement is Brownian motion, not living bacterial action. The large white particles are the very substantive ingredients of the Dental Herb Company formulation, which will remain in the sulcus for a while for further therapeutic effect. This subgingival sample was taken from an advanced class 4 periodontal patient. Many amoebae are present, but for the purposes of this recording, we are focusing on only one of them. Note the large numbers of white blood cells with cytoplasmic activity. Numerous spirochetes and motile rods are very active. The amoeba is a powerful microorganism capable of moving through even very crowded bacterial fields. Hydrostatic pressure from the lower left side first causes a stream of fluid to flow towards the upper right. Note that even though the stream is moving rather quickly, spirochetal activity remains the same, and the amoeba continues to send out pseudopods. As the tonic enters the field, the direction of the flow will change from upper right to lower left. Keep your eyes on the amoeba. Note the cessation of spirochetal activity, and as you continue to observe the amoeba, you will note the cytoplasmic material seems to dissolve and slowly disappear. Keep watching the amoeba. As you continue to observe this once virulent pathogen, note that its remnants fractionate and float away. It is quite evident that all microbial activity has stopped. Our products do not contain any alcohol, any artificial chemicals, or preservatives. They are formulated only with truly natural botanical ingredients. This antimicrobial effectiveness, combined with the tissue conditioning and connective tissue rebuilding properties, allows both the tonic and the irrigant to offer unmatched multiphasic benefits for your patients without the unwanted side effects so often associated with other products.